Good afternoon, everyone. I'm Michelle Steele, Chairman of the Orange County Board of Supervisors. Thank you for joining us today. From the earliest days of this pandemic, Orange County has been a leader in proactively taking action to protect members of our community. We declared an emergency early and took every precaution to ensure our community was protected. We continue following the county guidelines, and our citizens and businesses benefit as a result. This pandemic carries a heavy cost. Businesses and their workers took devastating hit. Families are still struggling. It is heartbreaking. Because we have taken and continue to take this pandemic seriously, and due to our community resolve, Orange County's number of COVID-19 have continued to remain lower than our surrounding counties and region. Governor Newsom today announced new guidance from the California Department of Public Health requiring the wearing of face covering in various public settings in the state of California. We are reviewing the order. I will address our updated numbers momentarily, but let me begin with some good news. Last week, Orange County Healthcare Agency Director and Acting County Health Officer Dr. Clayton Chow allowed for the opening of a large number of businesses. Today, I am pleased to announce that with the support of Dr. Chow, Orange County will issue an order to open personal services like nail salons and massage services and few others. I specifically want to address the nail salons in our community, which have been the subject of unfair attacks throughout the process. 80% of nail salons in California are owned by Vietnamese Americans, many of which are right here in Orange County. While we have continued to open more businesses, these hardworking people were excluded. I am delighted that starting tomorrow, these nail salons can finally open their doors. It has been far too long, and these businesses have suffered as a result. I hope that with this next step, these businesses will be able to quickly recover from their losses. Next, I will go over today's COVID-19 numbers, and then I will address specifically what those numbers mean in terms of where we are as a county. The Orange County Healthcare Agency reported 132 new cases of COVID-19 and 7 new deaths. This brings our total to 9,292 confirmed cases of COVID-19 and 250 deaths to date. Our hearts go out to those that were lost and their families. 1,199 tests were conducted today countywide, bringing our total number of those tested to 199,015. You can find more information on where testing may be found on HCA's website at ochealthinfo.com/COVID-test. Here we can find the locations and services over 27 locations countywide that conducting testing. We have been a steady but manageable increase in our numbers of COVID-19 in Orange County over the past few weeks. The majority of these increases are in skilled nursing facilities, which are 51% of our COVID-19 related deaths as of today. We must continue to work closely with our most vulnerable populations, but I am confident that because we have some of the most well-equipped, trained, and experienced medical professionals here in Orange County, that these populations are receiving the best care available. As of today, we have 345 hospitalizations and 144 in ICU. Of these, 26 patients are from outside of Orange County as of Monday. We've been assisting Imperial County, who has transferred these patients to our hospitals. It is our hope these patients will recover soon. But I am comforted knowing that they are under the care of our amazing healthcare workers and top-notch medical facilities treating these patients. So what these numbers mean, I want to be very clear with our community about where Orange County stands when it comes to our coronavirus numbers and what these numbers mean comparing to our surrounding region. The testing positivity over the 7-day average stands at 6.8%, continually under the 8% threshold set by the state of California. In terms of hospitalization, our percentage change in 3-day average COVID hospitalized patients stands at 5.8%. That is well below the 10% threshold set by the state. Our percentage of currently available ICU beds stands at 43%. That is well above the 20% minimum requirement set by the state. Orange County also has 68% of ventilators currently available. That is well above the 25% minimum requirement set by the state. As of today, Orange County has 4,496 recoveries, or 48.3% of the total confirmed cases to date have recovered. While an estimation, this data indicates that Orange County continues to have manageable numbers. We are watching these data very closely. Orange County continues to see lowest rate of confirmed cases and the lowest rate of COVID-19 related deaths compared to all our neighboring counties and the state altogether. Lastly, I would like to share some more good news. On Tuesday, the government of Taiwan delivered 20,000 masks to be given to hospitals, first responders, and skilled nursing facilities and private doctors and dentists in Orange County to assist those that are most exposed to COVID-19. We are grateful to have friends overseas who are willing to assist us in this time of need. Today, I am joined by Director of the Orange County Healthcare Agency and Acting Public Health Officer Dr. Clayton Chow. Again, I appreciate you all joining us today and welcome Dr. Chow.
Thank you so much, Chairwoman Steele. Good afternoon, everyone. My name is Dr. Clayton Chow. I'm the Orange County Healthcare Agency Director and Acting County Health Officer. The California Department of Public Health today issued a new guidance that requires face coverings in certain circumstances and provides a number of exceptions as well. For further information on the state's guidance, go to OCHCA's Twitter account at OC Health or on our Facebook at facebook.com/OC Health. As Chairwoman Steele mentioned earlier, Orange County continues to fare well when reviewing our data against the state's trigger thresholds. As discussed last week, the state is monitoring specific data points for all counties, such as elevated disease transmission via case rate and testing positivity percentage, increasing hospitalization via the percentage change in a 3 days average of COVID-positive patients, and limited hospital capacity via ICU and ventilator availability. As of yesterday, June 17, Orange County's testing positivity rate is 6.8% and has been stable. Our 3-day hospitalization average is 5.8%, and we have 43.4% of the ICU beds and 68.1% of the ventilators available for use. Orange County's numbers do not surpass any of the state trigger thresholds, meaning there is not a need to modify reopening plans. Now that the state has provided clear triggers for counties to monitor, as well as a person designated from the California Department of Mental Health to work very closely with our team, we are in the process of revamping the data available on our website to reflect the most relevant data points for our community. So be on the lookout for our new website. I call it version 2.0. With that, I'm pleased to share that I am approving the opening of expanded personal care services industry here in Orange County, effective tomorrow. My decision is based on my and my staff review of our local epidemiological data and Orange County's metrics related to disease transmission, increasing hospitalizations, and limited hospital capacity, which do not trigger any of the state's metrics, indicating concern and need for engagement regarding increased control measures. So in according with the state guidance that is also available on our website at ochealthinfo.com/forward, novel coronavirus, some examples of industry that may now reopen tomorrow include massage parlors, nail salons, tattoo parlors and piercing shops, estheticians, skincare, electrology, and cosmetology services, body waxing. The state's guidance is intended to support a clean, safe environment for workers and customers. It is crucial to note that according to the state, both employees and customer of the expanded personal care services sector must wear a face covering. I also want to reiterate the requirement that all businesses and sectors that reopen must complete their corresponding checklist and attestation and post it at the entrance in plain view of the public. If a business sector does not have a checklist, please just post the attestation. More information and a sample attestation is available on our website. Now I will take questions from the media at this time. Operator, can you tell us who has the first question?
Yes, ladies and gentlemen, if you'd like to ask a question, please press 1 then 0 on your telephone keypad. You may withdraw your question at any time by repeating the 1-0 command. If you are using a speakerphone, please pick up the handset before pressing the numbers. Once again, if you'd like to ask a question, please press 1 then 0. And our first question comes from line 14. Line 14, please state your name, your affiliation, and please limit yourself to one question only. Please go ahead.
There've been.
I'm sorry, we didn't catch your name, sir. Line 14, please go ahead.
Paul Anderson, City News Service.
Hi, Paul.
Yeah. There have been. I've received reports of several restaurants having to shut down in Orange County because of outbreaks. When I inquired about it, I was told that I wouldn't be. There would be no information given out. Wondering if you can talk about that. Why not? And don't you think that would be educational to the public in terms of why some of these restaurants are having to close down, or if you're having to take another look at what's going on with some of these businesses in terms of complying with the guidelines.
Sure. Thank you for that question, Paul. And so for any work site or businesses, including restaurant, if a case of COVID-19 is reported in a member of the staff, usually either the business will notify us because that's part of their guidance, or we identify individual through our contact tracing and figured out that, oh, that person worked for certain business. And if in that evaluation process, we find out that we need to work with the facility, and then we will contact the facility and provide guidance based on the particular circumstances. If there is a cluster of cases, depending on the number of cases and the size of the facility, we might either mandate that all the staff be tested, or a facility closed for a period of time until it is clearly safe to reopen, and that's the work of our communicable disease unit. The Orange County Healthcare Agency cannot confirm or deny details related to cases associated with a particular facility. So, next question, please, operator.
Thank you. And that comes from line 15. Line 15, please state your name and affiliation.
Thank you. This is Alicia Robinson with the Orange County Register. And I just wanted to ask, now that there is a state mask order coming down from the governor, what responsibility does the county have via the healthcare agency and or the sheriff's department to enforce that? And how would any such enforcement be carried out?
Thank you for that question, Alicia. So as far as the state order, you all know that the State Department of Public Health order or the governor's order will supersede whatever order that the local county has. So we're in the process of reviewing that right now. You should hear from us later on today or tomorrow. As far as the enforcement, I know there's conversation with the state around the enforcement area as well. So thank you for that question.
Thank you.
Next question,
Now,
please.
Line 20, please go ahead. Line 20, your line is open.
Thank you, Jessica Venova with ABC7 Eyewitness News. Thank you so much for taking our calls. Both questions asked previously kind of had to do with mine, so I will add on to the first question having to do. Dr. Chow, you sort of walked us through the process and talked that you can't reveal the specifics of outbreak in certain businesses. A relative of mine is caught up as an employee in a potential outbreak, and the ability to come by testing has proven quite difficult. He was actually told to go home and self-isolate, not knowing whether there was a positive case in his place of employment, but all staff were asked to go home. They were asked to self-isolate, and they were serving the public. So when I called the county department concerned, because again, this is a relative, and then I'm wondering about my own personal exposure, and I know I'm not the only one going through this because I've heard from several relatives and friends of cases like these. I wonder, why are we not making appointments easier to come by? We are having to wait days to get this testing, and we are also not allowing some of these employees to be tested because they are not symptomatic. So what if they're asymptomatic?
Right.
Why aren't we allowing for more access to testing?
Right.
Thank you.
Thank you for your question. Actually, anyone who believe that they're exposed to COVID-19 can get testing, and our recommendation has always been, if you have a primary care physician, you need to contact your primary care physician, get referral. In cases that you don't have a primary care physician, or you don't have insurance, or you're underinsured, you can always come to the county network of testing site, particularly the state OptumServe site, which we posted on our website. So I would encourage you or your relative who in that scenario to come onto our website, ochealthinfo.com, and go on the button that said testing site, and then utilize the test site that we have posted there.
With all due respect, Dr. Chow, this is what we're doing, but we are having to wait days or are being told we cannot test because we are not symptomatic. So what do we do from that point forward?
So call Molly and we can figure that one out for you, because I've also have had people who contact me personally and I guide them through the process and they have appointment right away. So I'm not quite sure what happened
Thank
there.
you, Dr. Chow.
Yeah.
I appreciate it, but the general public doesn't have access to the public information officer for the county the way I do. So for the general public, for the rest of Orange County. Again, I'm not trying to be argumentative.
No worry. So here's the number to call us. Okay. So we have the COVID-19 hotline. The number is 714-834-2000. Okay. Let me repeat that again.
That's the number I called.
Really? Oh, send us an email then. It's eteam@ochca.com. Okay?
Okay, all
Okay.
right. I will send an email, and
Perfect.
I hope I get a response asking for an interview individually about this.
Perfect.
Thank you so much.
Thank you. Next question, please.
Thank you again. 10 if you'd like to ask a question. And now to line 7. Please state your name and organization. Line 7.
Oh, hi, Dr. Chow. Thank you very much. This is Amy Paxton from the Associated Press. I know you said you're reviewing the governor's order regarding facial coverings, but I'd like to see if you can please comment on the state's decision to require them. It seems to reinstate the same order that you yourself changed about a week ago. And I wanted to know if over the past week, if you've seen anything in Orange County in terms of the data or the public's response to your change that makes you feel that this statewide order is warranted or not.
Wow, that's a hard question. So when we work with the state and we look at our own number, our own data, our data, as I told you earlier, still look fairly good. And so as far as our decision, I believe that we made the right decision. As far as the current decision from the state, if you read the order and the reasoning behind it, it's very clear that this is an order for all Californians, not any specific place. So in that sense, I can't answer for the governor or CDPH, except for that's the decision for the entire state. Next question, please.
Thank you. And that comes from line 5. Line 5.
Hi there. This is Shayna Stabler with Stu News. My questions are in regards to the trigger thresholds. The data reference the state's metrics.
Yes, ma'am.
Regarding the county's test positive rate,
Yes.
can you please provide the number of people who have tested positive for COVID, or not positive, the number of people who have tested for COVID-19, so that we may compare this to the number of people who have tested positive. As you know, frontline workers, skilled nursing facility residents are being tested
Yes.
many times,
Yes,
as they
yes,
should
yes.
be, 10 times,
Yes.
many times, although,
Yes, yes.
you know, a separate conversation, a separate question will be not enough. These people can be counted many times in the test stats, but they can only possibly be counted once in the cumulative cases stat, hopefully never.
Right.
So that's one question. And then on this matter, can you please clarify, if someone tests positive for COVID-19 and is retested multiple times, resulting in multiple positive readings, which is a standard treatment testing protocol that doctors employ with their patients, before testing negative, are those additional tests counted in the overall test data? Thank you.
So the way we pull our data is from CalReady, which is a state database. So the number that Chairwoman Steele gave you earlier, the total tests of 199,015, as well as the number of people who are positive, are directly out of the CalReady database. As far as the
But I understand that. Sorry, but you're comparing people to tests.
I'm getting there,
comparing
ma'am.
cases to tests. Okay. So I don't know if that's a like comparison. I don't know if you can compare. They're unlike terms that are being compared here.
Right. I agree with you. It is not. And then so there's some conversation with the state about how does the state report the number and how does the state calculate the number, and we are following the state direction. And I hear your argument on if someone tested negative and you test them again, do you count it on one individual or episode of test, right? As you know, just because you're tested positive to negative today, it doesn't mean that you will test negative tomorrow. And so that go back to the science of the uncertainty of this virus that we are trying to learn. You have a very good
Understood,
point,
but
and I know.
How can we compare the number of tests, which can result in multiple tests for one person, to the number of cases, which can only possibly result in one case, hopefully none, per person? How are we comparing those two and getting a positive data rate from those two unlike terms that we're comparing?
As I told you, we're having that conversation with the state now because that's the way the state calculated, and I hear you, and we have active conversation, and the person who monitoring Orange County just get started. In fact, we just finished our conversation 2 days ago, and this was brought up. So as we get more direction from the state, I will follow up with all of you. Thank you.
Appreciate that. On the second question, when someone tests positive multiple times within their doctor treatment setting, as I know many COVID patients, they test multiple times with their doctors until they get that negative reading to know, they've got that peace of mind. Are those additional tests, so say someone's tested 5 times with 5 positive readings, 1 time with a negative reading, are all 6 of those readings counted in the current test data, cumulative test data? Or is that data not included?
So again, that's a good question. From a medical point of view, I can't imagine a physician who tests someone positive and immediately for the next few days test them again. Usually what you do is you wait at least 14 days that you would test them again, but usually that's not something that a physician would do. So I can't really answer. If there's a physician who actually does that, I imagine that lab get reported to CalReady and it would be factored in as such. So it's a good question. I'm going to talk to my state person and see. And perhaps what we need to do is talk to the medical community and see if there's any physician who does that and ask for the reasoning on why they do that. So thank you for your question. It's a great point. Next question, please.
Thank you. Thank you. And that comes from line 16. Please state your name and affiliation.
Hi, Alex Lemonidis from the New York Times. I was wondering if anyone who had attended or worked at recent protests in the area, including members of law enforcement, has since tested positive for COVID-19.
I don't believe we have that information. I'm so sorry. I will go back and ask. Thank you.
Thank you.
Next question, please.
That comes from line 17. Please go ahead.
Hi, this is Nick Gerda with Voice of OC.
Hi, Nick.
Hey, Dr. Chow. Thanks for taking questions. I had 2 kind of areas of questions. One on the governor's new mask order.
Yeah.
I was curious, Dr. Chow, what your message is to the people of Orange County regarding masks, and what do you say to people who are opposing wearing masks when they are within 6 feet of other people who aren't part of their household? And then the second area of questioning, we saw today that Orange County's rate of ICU patients with COVID is now higher on a per capita basis than all of the surrounding counties, including LA County. It is the highest among the 10 most populous counties in California. Orange County used to be a lot better than the surrounding counties. Now it's outranking on the ICU patients per capita. I'm just curious for your comments, your thoughts on that.
Thank you, Nick. Let me answer the first question first. I guess what we'll do is we are reviewing our order right now to make sure that it's not in conflict with the state, and you know that, right? So any state order supersede the county, and so be on the lookout for our new order, I guess, or amended order. I'm in a conversation with our legal counsel right now in how to reconcile that piece. As far as your question about the ICU, unfortunately, I don't have the ICU number, but if you look at the overall daily hospitalization rate, Orange County is 10.2 per 100,000. Los Angeles is 13.8. We trail behind LA, and San Bernardino is 10.1. So we are in the middle. So you're right. We're in the middle. But when you look at the number of ventilator and the number of ICU bed available, we are still very good. I mean, it just means that perhaps the number of people who are in the ICU are mainly people who are very sick, our senior population, as well as individuals who have comorbid other condition, and that make it difficult. And so the good news is, Nick, is you probably, and for all of you, you probably heard a couple of days ago, there's new study now that approved dexamethasone, which is an old drug that they found that if you treat people who are very severe, a third of them, you can prevent death. So I'm so excited about that piece. Thanks for your good question, Nick. Next question, please.
Thank you. And that's line 8. Line 8, please go ahead. Line 8, your line is open. Well, we
Yes, there I am. Sorry about that. This is Matt Leslie with the Fullerton Observer. And
Hello.
I'm wondering, Dr. Chow, if you can tell us how close, at what number of hospital capacity do we reach before you begin to advise dialing back, that is, to maybe cutting back on reopening and pulling back on public activities?
Very good. So I have that number. I know I have that number somewhere. Let me pull that out. You guys are tough on me today. Okay. Give me 1 second. Thank you for that question. So our inpatient bed capacity is 3,757, and currently 64% of them are, no, let me see, is that right? Let me look. Bed occupancy. So currently we have 3,757 bed occupied in Orange County, which is 64% of all the total bed. We are actually quite good. Unfortunately, on the state website, as is related to the monitoring of the number of bed, I know the state said that they're going to issue some more number as related to regular bed, hospital bed, right? Currently, the only monitoring criteria that they're following is the ICU bed. But we had a conversation, in fact, 2 days ago, and this morning too, is asking the state whether or not the state's going to be monitoring the total number of hospital bed as well. So I should have that pretty soon, so we can talk about that.
Can I ask you quickly as well about the mask order?
Yeah.
You're saying you're reviewing it. Does it not simply become superseded by the state? And more specifically, last time this came down, OC Sheriff Don Barnes simply announced that he would not enforce it. How is that the case? Could that be the case with the state one, or does the health agency have any influence at all over what the sheriff does in this case?
The reason why I say I'm reviewing it is we're reviewing the exception because the state has some exception. That's what we're reviewing right now. As far as the sheriff, maybe you want to call the sheriff. Sorry, Sheriff Barnes, I didn't want to put you on the spot, but yeah, you might want to talk to Sheriff Barnes about that. Thank
Will
you.
do. Thank you.
Thank you. Next question, please.
Thank you. That comes from line 12. Line 12, please state your name and affiliation.
Hi, Dr. Chow. This is Chip Yost with KTLA. I had a question on the mask order. As you know, and everybody listening knows, there's been a vocal opposition to the mask order in Orange County showing up at the Board of Supervisors meetings. And during one of the last meetings, you gave a defense of the mask order that was in place at the time. Can you talk about what you say to the opponents of the mask orders and why you believe the masks work, as you kind of stated at one of the last meetings?
Yeah, and I think I made it very clear, even when I dial back on the order, that masks worked, right? We have more data now, more paper being published in Lancet, in Science, in the British Medical Journal, speaking about the face covering and how it really does have an added protection in terms of the spread of the virus, right? And to the opponent, I said this, you've heard me say that from day one since I took the helm of the director of the healthcare agency until now, and that is the mask is to protect others, to protect your neighbors, not necessarily very much about you. And so from a public health point of view, we want to protect our neighbors who are vulnerable. And that's the point that I'm trying to drive through. So thank you for your question. It gives me an opportunity to repeat what I believe and what science said, right? Not just my personal belief. So thank you so much. Next question, please.
Thank you. That comes from line 18. Line 18, please go ahead.
Dr. Chow, this is Norberto Santana for the Voice of OC. Thank
Hi,
you again
Norberto.
for being the only. Thanks again for being the only elected official, or the only appointed official up there taking these questions. So I appreciate your work up there. I do have a question for you about two places, Anaheim and Santa Ana. When we hear general county officials speak about Orange County, they're talking about numbers and averages from the county as a whole. Yet when you look at just Santa Ana and Anaheim, it presents, frankly, a very troubling picture of rising infections at a much higher rate. And I'm curious, have you all started to, with contact tracing or other things, have you started to drill into those numbers? And do you have conclusions as to what's happening there? Are those service workers? Is there community spread? I know that jails that are in Santa Ana have been taken out of those city numbers, but do you share the same concern that those numbers are way above anything nearby? And do you guys have any conclusions yet as to what's happening there?
Thank you, Roberta. That's a really important question. Beside the worry about our children, these two cities keep me up at night. We have started the conversation with a group of community-based organizations with the city councils of Santa Ana and Anaheim, with the school district in Santa Ana and Anaheim. Who else? Let me think. With Supervisor Doe and Supervisor Wagner's office. And I know there's more people. There's a group of us, like 26, 27 people. We just about 2 weeks ago started the conversation. We're going to drill down into the number. The good thing is the current number that you see in our website does not take into account the people who live in a congregated setting. So when we factor those numbers out, the number is not as bad, even though they're still high, but it gives me a sense of somewhat of a relief that there's room for us to work together with the community organization. I know the community clinic that serves those two cities. So what we're trying to do now is we form a task force already with several subcommittee. What we're going to do is we're going to do targeted community education and outreach, working with the promoters from some of the community-based organizations to go into the community. What we need to do is educate the community on what does it mean when you have tested positive for COVID or you're exposed to COVID, what is it that you need to do, and also provide the services that they much needed, right? Housing, social services, etc. So there's a group of us that are working closely together now. There's a media campaign that you will see come out next week, really looking at our vulnerable population, really looking at our ethnic community. As you know, in Orange County, the two ethnic communities that are disproportionately affected are the Latinx community and the Black community. So we are doing everything we can to outreach to the community, and particularly outreach to community that are economically not doing quite well to start with, and now with COVID-19, this effect is huge, right? And so follow us. We might need your help to educate the community as well, because for me, those are the two communities that keep me up at night, and we are working very hard with the community-based organizations and with the school and et cetera to really tackle that. We call them the hot spots in our county, and we really want to go in and do prevention and early intervention. So thank you for that question, Roberto. One more question I'm signal. So next question, please.
Thank you, and that comes from line 6. Line 6, please go ahead.
Hey, Dr. Chow, this is Haley Winslow from Fox 11. Thanks for taking my question and for what you guys are doing. I know you've touched on this already, but just final thoughts to your community. As the health official, what are your thoughts on the governor's mandate on mask wearing?
So I think you probably heard me talk about my dialing back because of no enforcement, and because I was thinking that that would be a strategy should our number ever gone bad, knock on wood, and that would be a solution to have a county-wide mass order as a first step before we start talking about reclosing business, because for me that would be the most devastating decision that at least in my perspective, that I have to make, right? Because you've seen the effect on the economy from this pandemic. And so now that that strategy sort of take away, I have to work very closely with my monitoring person from the California Department of Public Health to come up with a list of other strategy as well. So should we ever get there, I will make sure I communicate with all of you to figure it out. Because last time, as I said last week, this is a community effort. And we want to enlist the entire community to help us to reopen safely and actually have a healthy community. So thank you for that question. I think that's it. Thank you all for your time. And like I said, you can always get in touch with us through Molly, and we will work with you very closely as we move forward in reopening our community. So thank you so much.
Thank you. And ladies and gentlemen, that does conclude our conference for today. Thank you for your participation and for using AT&T Event Conferencing.